have a new cancer diagnosis, the thing that patients really want to know and their families want to know is, how dangerous is this for me? And what is my prognosis? What's my chance of dying from this? And if I'm going to die from it, how long is it going to take for me to die? Those are the questions that I think people really want to know the answer to and are sometimes afraid to ask the doctor. And the doctor sometimes can't give a definitive answer. The way I would approach this with a patient in my office would be starting off with the type of cancer that they have and the stage of cancer that they have. Is that cancer a curable cancer, or is that cancer a non-curable cancer? And I really just divide them into those two buckets at first. If it's a curable cancer, then we would try to do everything that has been proven to be helpful to give the patient the best chance of cure. There's another category of patient, and they have a metastatic cancer that has spread within the body. And those patients, some of those patients, we know from the beginning we're not going to be able to cure their cancer. The conversation that I think is best for a patient with that situation is to say, it's not curable, but it's treatable. And these are the ways in which we can help you with pain or progression of the cancer to other places or symptoms that you might be having from the cancer. Making sure that the patient understands what the goal of care is, whether it's trying to cure them or whether it's trying to palliate symptoms, that's a really important thing to elucidate and to talk honestly with the doctor and the doctor to talk honestly with the patient and their family about. The other important thing about, is this cancer going to kill me, is that doctors don't really know how long a patient's going to live if they have a metastatic cancer, because it very much depends on how they respond to treatment. So if a patient takes therapy and has a very good response, they might live quite a bit longer than if they were taking a treatment and the cancer kept growing and wasn't responding to the treatment. So though we can get an idea of the tempo of the disease over time if they have metastatic disease, the doctor doesn't know really to say, oh, you have 6 months or you have 3 months or you have 4 years. It's very difficult to accurately predict that.